Hey team, welcome back to the joint series. We are talking about the elbow today. Now, the elbow, as you know, has only a couple motions in it, but the surrounding muscles around it usually causes us some aches and pains. How do we fix this, right? So, such as tennis elbow, golfer's elbow, and so on, we'll get a lot of aches and pains that last a long time. This is a lot of times due to repetitive motion. Now, to mobilize this, there's a couple things you can do. One, if the outside of your elbow hurts, you can start with your hand down and then pull, using your other hand to pull it down. Hold it about 20 or so seconds, 3 times. If it's hurting on the inside, we're gonna pull our hand back and pull it that way. So just the opposite. So that's one way to mobilize it. Another way is called an active release technique. So you're going to contract the muscles. So remember, if our hand's going up, the muscles come from here, okay? They're extension muscles. We're going to get our hand, you're going to contract it, shortening the muscle, digging your thumb in, and then slowly stretching through it. Releasing your thumb, recontract, and so on. You can hunt all the way around here, and the same for the inside. So you're going to palm up, contract that muscle, dig your thumb in a little bit, and then fully stretch it out. Do this about 1 or so minutes, up around 1 to 2 minutes, up around the area that's bothering you, staying away from any bony areas. Now, that's to mobilize it. That's only a temporary fix. So, to strengthen it and to get some Advil, as I like to call in those tendons, I like to do something called the Jill Cook protocol. Now, what is that? This requires a higher load on those tendons because the tendons need a lot of load to get anything out of them. So, without any equipment necessary, if the outside of your elbow is hurting, you're going to flip your hand down about halfway. You're going to take your other hand, and all you're going to do is maximally contract that hand up into that non-using hand, okay? So from here, I'm going to hold that as hard as I can for about 45 seconds. Rest for 2 minutes. Do this for 5 rounds, okay? After that, kind of move around. This should help those tendons feel a little better. If you can do this 1 to 2 times a day, even better. But try that out. And if you don't have any weights, just use your hand. If you do, grab a dumbbell. Same thing. So 45 seconds on, 2 minutes off, 5 rounds. Let me know if you have any questions.